This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, good evening, Tampa Bay, and welcome to the first episode of the show for 2018. And I pray that you have a blessed and prosperous New Year. And the website, of course, is OutbreakNewsToday.com, OutbreakNewsToday.com, and the Facebook page is Infectious Disease News. And let me go ahead and, before my first guest, I'd like to go ahead and start with a Florida story. And something I've been doing on the website for several years now is really monitoring the leprosy cases that are in the state of Florida. And for, more than a decade, Florida would see 2 to 12 leprosy cases annually. Then in 2015, we had this explosion, and don't know if it's because it was more recognized or more people handling armadillos, but we saw 29 cases in 2015. Last year, 18 cases. And this year, the final numbers from the Florida Department of Health tells us there were 16 Hansen disease cases in the state of Florida, with Brevard and Volusia County seeing the bulk of them, 5 cases apiece. So that's the latest on leprosy in the state of Florida for 2017. Now, my first guest today is one of the most prominent proponents of vaccinations. And if you follow his Twitter page like I do, he's been sounding the alarm for some time about the growing anti-vaccine movement. So joining me now to discuss the anti-vaccine movement and to get some of his thoughts is Peter Hotez, MD, PhD. Dr. Hotez is the Dean of the National School of Tropical Medicine at the Baylor College of Medicine. Dr. Hotez, welcome back to the show, sir.
Thanks for having me back.
You bet. Before I dig into your thoughts and concerns about the rising anti-vaccine movement, which I'm sure you have a lot to say about, can you spend a moment just describing to my audience the incredible successes of vaccines over the decades?
Sure, and we have actually very good metrics about the successes because of an organization called the Institute for Health Metrics and Evaluation. It's based at the University of Washington, Seattle, but they've established what's called the Global Burden of Disease Study that yearly tracks the number of people with just about every health condition imaginable. It's a massive initiative of hundreds of scientists and public health experts funded by the Bill and Melinda Gates Foundation. And one of the things that they've done is track the decline of infections that are preventable by vaccines, diseases such as measles and diphtheria, pertussis, and tetanus, and Haemophilus influenza type B, polio, hepatitis, you name it. And the numbers are quite striking. So particularly since the creation of Gavi, which is an acronym that stands for the Global Alliance of Vaccines and Immunizations, and now they just call it the Gavi Alliance. This was also started by the Gates Foundation, launched with $750 million of Gates Foundation seed money, and it's to provide increased access, especially in poor countries, for vaccinations. And what we've seen now over the last 2 decades is an 80% reduction in deaths from measles and pertussis and tetanus and all of those diseases that we've been talking about. So this is a slam dunk success, and that's incredibly exciting and I often call it one of the most successful public health measures ever launched, is this big alliance for vaccines. That's the good news. The bad news has been shortly before Gavi was created, the phony paper was published in The Lancet that was ultimately retracted by Wakefield and his colleagues in the UK, and that was published in 1998, but it took 12 years for that to get retracted. So you had these two yin and yang forces. You had this very positive force of Gavi and the great successes globally, but then in Europe and ultimately in the U.S., you had this step backwards where people were withholding or opting their kids out of getting vaccinated because of this a movement that was ignited by this paper that was ultimately retracted.
Right, and you've written before that all these great gains in against infectious diseases, thanks to vaccinations, are fragile. Now, this is part of it, I take it.
Yeah, absolutely, especially for diseases such as measles. And I talk a lot about measles, and people say, well, why of all the vaccine-preventable diseases, why do I emphasize measles so much? I do it because it's so highly transmissible. So if a single individual who has measles will, on average, infect 12 or 18 other, will give measles to 12 or 18 other individuals. It's one of the most transmissible agents known, and the ones who will get it, and the ones who are most susceptible, are babies under the age of 1 who are not yet old enough to receive their measles vaccine. So measles tends to be often the first breakthrough infection that we see as vaccine coverage declines. So, for instance, in California, you had, with the increase in the number of non-medical exemptions for philosophical belief reasons since 2000, what happened by the year 2015, 2016, you had a massive measles outbreak in Orange County and ultimately Marin County, California, that sent a number of kids to the hospital. It caused dozens of measles cases. It was a terrible outbreak, all because of this anti-vax movement. And then we saw it again last year in 2017 among the Somali immigrant community in the Twin Cities in Minneapolis, St. Paul, where you had 40% of the kids not being vaccinated. You had this terrible measles outbreak, affected 80 kids, and landed 20 of them in the hospital.
Now, it's pretty clear that the anti-vaccine movement in the U.S. it's got political influence. There's a popular documentary. They had a march last year in Washington. Where do you fear this is progressing to?
So you're right. I think the anti-vax, and my concern is, and I wrote about this in the New York Times last year, I had an op-ed piece in the New York Times with the editors gave the title of How the Anti-Vaxxers Are Winning. And it basically describes the battleground that's going on in the 18 U.S. states that allow non-medical exemptions or exemptions for philosophical belief exemptions. It was California, but then they closed that option after the terrible measles outbreak. The California legislature woke up, but we still have 18 states that allow it. And my worry is the movement is gaining a lot of momentum and strength, and so we're going to continue to see measles outbreaks across those 18 states. And we've now identified about half a dozen cities in the U.S. where the number of non-medical exemption rates is off the charts, and I'm particularly worried about measles outbreaks happening there.
Yeah, and I saw an article in Mother Jones in the past couple of days, and you mentioned about the California situation. It looked like things were getting under control, but now they're seeing a spike in medical exemptions thanks to willing doctors.
Right. So, I've been so focused on the non-medical exemptions for philosophical belief reasons. It never occurred to me that doctors would actually be, to use the word of the day, complicit in this, and now are buying into patient objections and actually allowing medical exemptions for opting kids out of vaccines of kids who shouldn't be getting exempted out. So that's really concerning as well.
Right. Now, you stated before in an article that you were very concerned of this movement here in the U.S. spreading to large, middle, and low-income countries, Bangladesh and the like. What is the danger there in your view?
Well, here's my worry. My worry is, the U.S., we do a great job in the U.S. of exporting our culture. We export our rock stars, we export our Hollywood movies, we export our fast food restaurants, both the good and the bad, right? And you go to places like India or Bangladesh or Nigeria, and you'll see McDonald's and Kentucky Fried Chicken, and you could buy American music. I'm worried now that we're exporting this anti-vaccine movement, and particularly among the middle classes in these large, low, and middle-income countries, the BRICS countries, Brazil, Russia, India, China. I'm worried about Nigeria. I'm worried about Indonesia, because we've worked so hard to create these gains and to reduce the prevalence and incidence of these terrible and childhood infectious killer diseases. Now I'm worried that we're going to reverse gains to this anti-vaccine movement in those low and middle income countries where things are so fragile right now.
Yeah. Now, I'm quoting you from the same article from last year. I think it was in Scientific American. You wrote, an American anti-vaccine movement is building, and we need to take steps to snuff it out. So, Dr. Hotez, what steps do you believe need to be taken?
I think it's pretty straightforward. I think what we need to really, one of the complexities of vaccine policy is that a lot of vaccine policy is not regulated at the federal level. It's regulated at the state level. So it's the state legislatures that determine quite a bit that has to do with vaccine policy. So I think the first step is to go to each of those 18 states that currently allow non-medical exemptions and shut down that loophole, including the state where I live and work as a vaccine scientist in the state of Texas. And I get a lot involved in this because I not only am a vaccine scientist, but my youngest daughter, Rachel, who's 25, is an adult with severe autism and other mental disabilities. So I wear both hats. I'm a vaccine scientist and an autism dad. So I think the first battleground is at the state level, really reaching the legislatures in those 18 states to stop non-medical exemptions. And even though a lot of policy is done at the state level, there's an awful lot of advocacy that needs to be done at the federal level. So we've not, unfortunately, for the last more than a decade, we've not really had a director of the CDC or Centers for Disease Control and Prevention or a Surgeon General or a Health and Human Services Secretary really speak out forcefully on behalf of vaccines, and we need to change that as well.
Now, I had you on the show, I don't know, a year or two ago, and one of the things you told me was because of the situation in Austin and the anti-vaccine movement in your state, that you predicted a measles outbreak in 2018 in Texas. Do you stand by that?
Yeah, well, who knows if it's going to be 2018 or 2019, but the likelihood is pretty good. And we know from the pre-vaccine era in the United States that we saw measles outbreaks most commonly at the end of the winter, beginning of the spring, so kind of around March. So beware the Ides of March, I guess, is the message, and that's what we'll be concerned about, especially in places, in Texas. We have some of these private schools in the Austin area where 30-40% of the kids are not being vaccinated. That's just asking for trouble.
No doubt. Any final thoughts?
Yeah, I mean, this is a self-inflicted wound. I mean, we've worked so hard through the Millennium Development Goals and now Sustainable Development Goals. We put in place everything that needed to be done. We put in place the Gavi Alliance. We've got now a tremendous expansion of vaccine coverage across the globe, and now here in the U.S. and in Europe, we're doing everything we can to erode those gains, and it's just so disheartening to see it happen. And I'm quite worried about my state of Texas as well as the 17 other states that allow non-medical exemptions, and that's why I'm working so hard to not see that happen. I'm a working scientist. It's everything you can do to keep up with the grants and the papers and the lab meetings. It's not my first choice to take time away from this to speak up on behalf of vaccines, but there's so few others that are doing it. I feel it's absolutely necessary.
Right. When you're doing a yeoman's job, I must say. Dr. Peter Hotez, thank you, sir, for your time and expertise once again.
Great. Thanks for having me.
You bet. Okay, well, sticking with the topic of vaccines, I'm going back on my website, and I saw a article that I published in December of 2014, and there's a anti-vaccine website out there called vactruth.com, and they were pushing this on their Facebook page. This is 3 to 4 years ago, that they were suggesting a vaccine homosexuality link. And absolutely, this is absurd, and you would have thought that would have just went away and vanished, and it wouldn't pop up again. Well, unfortunately, and I'm a Christian man, and I have to say that this is kind of disturbing for me. Apparently, there's this Christian activist. His name is Dave Daubenmire, and he put out a little video about a minute long, and essentially he's blaming vaccines for the rise in LGBTQ people. So let's go ahead and take a listen to that.
I read a lot of stuff. And have you guys noticed this? Have you noticed the explosion of deviant sexual proclivities? It used to just be homo and straight. Then it was homo and straight and bi, and homo and straight and bi and trans, and homo and straight and bi and trans and gay, and homo and straight. They keep adding initials, right? And I was reading something that this is happening. Literally, this is happening because our DNA is being changed. And our DNA is being changed not only through what we eat, but through the stuff that we're seeing right here. Who knows what was injected into some of these deviant sex people as children? Who knows what was, when they say they were born that way, maybe they were vaccinated that way.
Ouch. I'm sorry. That just does not help. And I don't know what his source was. Maybe he was reading vactruth.com. Or, I mean, this is right out of the book of Alex Jones, and it's quite disturbing. And so just thought I'd share that with you to let you know that there's people actually out there saying that. And I want to tell you that I believe he's 100% incorrect on that topic. I want to go ahead and go back to the Mother Jones article that I mentioned briefly when I was talking to Dr. Hotez. And, of course, there was the Disneyland measles outbreak in late December 2014, and went through the first several months of 2015. And the author of this article, Joanna Nix, writes, among the California patients in the Disney outbreak, at least 36% had not received their MMR vaccine. And despite school requirements, it was easy to skip immunizations. All parents had to do was sign a form stating, immunization is contrary to my beliefs. So during the nearly 20 years from 1996 to 2014, the rate of kindergartners with personal belief exemptions quintupled. Well, of course, then the Disneyland outbreak occurred, and state lawmakers passed a law, SB 277, which I've talked about before with Dorrit Reese on the show, and which eliminated the personal belief exemption. All right, this is it. California did the right thing, and the vaccination rates for kindergartners went up to about 96%, and huge increase over the past decade or so. However, and part of the bad news we talked about a little bit with Dr. Hotez is that while the number of personal belief exemptions plummeted, medical exemptions, which require the signature of a licensed physician, have risen. And researchers have found that over the past 2 school years, the rate of permanent medical exemptions for kindergartners tripled. And fueling this spike in medical exemptions is the industry of doctors that are willing and sometimes eager to flout the recommendations of the CDC in the name of parent choice. And basically the last thing Joanna Nix writes is, to be sure, there are medical conditions that do merit an exception. Children whose immune systems are compromised, and they might not be able to handle the vaccines. But kids with a legitimate need for a medical exemption account for just about 1% of the population, tops. So there's no way that, up to a quarter of all kindergartners in a school would have a valid medical exemption reason. So it's a very interesting article. It's in Mother Jones, and it's titled, "There's a Whole Cottage Industry of Doctors Helping Parents Skip Their Kids' Vaccines." It's a kind of a troubling piece. If you want to go ahead and check that out, I'll put it in the show notes later. Now, over in France, they're doing things a little bit differently. The children born in France as of this past Monday will now receive 11 compulsory vaccines. This is up from 3 that they did prior. Or they risk being barred from going to nurseries or school. And the French government's announcement seeks to stamp out a growing nationwide skepticism towards vaccines, and one of the world's highest vaccine rejection rates. In fact, in France, somewhere around 30 to 40% of the population consider vaccines unsafe. Pretty high. Now, the French Minister of Solidarity and Health, her name is Agnes Buzyn, announced the measure seeking to extend vaccine coverage further than the current 70% of child population already vaccinated. Quote, "I do not like to impose obligations. It goes against my character, but with vaccinations, it is justified," she said. So prior to this new law, France's mandatory vaccine list was only diphtheria since 1938, tetanus since 1940, and polio since 1964. So the 8 new compulsory vaccines will be pertussis, measles, mumps, rubella, hepatitis B, Haemophilus influenza B, pneumococcus, and meningitis C. So France has taken a different step than some other countries. And something we've been reporting on the website is diphtheria. We're seeing a lot of diphtheria increasing. And this is a very, very serious and deadly disease. We're seeing it in Bangladesh right now. We're seeing it in Yemen, just another problem for Yemen. And Indonesia is seeing increase in diphtheria. And in an article in Pathos, the author says part of this problem is it's due to Muslim anti-vaxxers. And the author writes, the anti-vaccine movement in the U.S., fueled by celebrities like Jenny McCarthy and Jim Carrey, with assistance from religious groups that oppose vaccines, has led to a serious measles outbreaks across the country. And as Indonesia deals with its own deadly diphtheria crisis, we can't help but note some of the parallels. And so what's happening? A lot of fundamentalist Muslims in the country think that vaccines violate Islamic law, so they're not getting their kids vaccinated. According to one pediatrician in Indonesia, many Muslims believe that following Sunnah, or the way of the Prophet, is enough protection against diseases. And so, some believers just think they don't need vaccines if they follow Allah's law. And there's a similarity, according to the author, to the Christian scientists who refuse to see doctors and believe, the prayers are enough to treat. So there are some parallels, but diphtheria is some serious stuff, and it's a shame to see anybody taking this lightly. It's very, very serious stuff. And as I mentioned, in war-torn Yemen, after having 1 million cases of cholera last year, now they are up to almost 500 cases of diphtheria with 46 deaths. So you're talking about 10% of these kids have died because of something that a vaccine could have taken care of. Different scenario, they're being bombed to smithereens there, but diphtheria is some serious stuff. Okay, After the break, we're going to have a little discussion and a year in review and take a look at 2017. So I'll see you then.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the show. Now, I saw an op-ed piece in a paper called the Himalayan Times, and this physician from Nepal wrote that Nepal has found their first laboratory-confirmed Lyme disease case ever. So he's prompting a notice for healthcare providers and policymakers in Nepal to say, hey, this tick-borne disease is here, and we got to be aware of this. Apparently, the patient was a 32-year-old individual who showed up with symptoms of fatigue and pain, and it was confirmed. Now, it's not easy to get laboratory confirmation in Nepal. It's expensive and it's not readily available, the testing. But, this physician says that, the ticks that carry Lyme bacteria are widespread, particularly in the Himalayan region of India. India's had some Lyme disease too, meaning that, this disease may be vastly underreported in that part of the world. So at the website, OutbreakNewsToday.com, we'll be keeping our eyes on that very closely. Well, we said goodbye to 2017, and there's a number of websites that put out their own versions of a year in review or a top 10 stories, etc., including mine at OutbreakNewsToday.com. Now, Dr. Judy Stone is an infectious disease physician, and she's a contributor to Forbes. And she's also expressed her views in an Infectious Disease Roundup 2017 article. And Dr. Stone is here this evening to talk about it. Dr. Stone, welcome back to the show.
Well, thank you for having me again.
Yes, ma'am. Now, let's dive right into your piece. And you start out with a concern we can all agree on, and that's antibiotic resistant. And you write that overall the news is pretty grim. How did this particular topic grab your attention last year, and it made it to the top of your list? I don't know if you were ranking them or anything, but it was the first thing you mentioned.
Right. Well, some of it comes from my patient care, and that's the main driver. So until this past year, I worked at a hospital near Pittsburgh where I was seeing patients with a bacteria that was resistant to everything but colistin, which is, as I'm sure you know, a last-ditch antibiotic, right, because it's so toxic and it causes kidney failure, seizures. And while I only treated a few patients with that antibiotic, I don't recall any of them having gotten better. I don't see that particular resistant gram-negative bacteria where I'm working now, which is on the other side of the state, but this current hospital has a different population that feeds into it. And instead, now I'm seeing patients with a tremendous amount of IV drug use, infections with abscesses or heart infection. The other thing that my patient care has made me attuned to, though, is that fuels resistance is the patients claiming drug allergies. And I wanted to caution your listeners about that, because when somebody says, oh, so-and-so told me when I was a child 50 years ago that I was never to take an antibiotic again, it forces you to use more toxic antibiotics. And this also drives antibiotic resistance. So please, I hope people won't say that they have a drug allergy unless they get hives or trouble breathing. And an upset stomach doesn't count. Mm-hmm. And that's really critical. And I encourage my patients to keep a wallet card with what the actual nature of the reaction was and when it happened. But anyway, going back, the other news was that antibiotics in livestock continues to be a huge problem. And there was recently a study out that said that more than 70% of antibiotics that we need for patient care are sold for animal production. And we've seen some improvement in that in chickens, I guess because of the public pressure. Fast food places are cutting down on antibiotics in chicken, but it's still a huge problem, particularly for pork and beef. And we just are squandering the antibiotics, and nobody is making new antibiotics because it's not profitable.
Right. So the WHO report that came out a couple months ago, that there's 8 new antibiotics that are fresh in the pipeline, and that's basically it.
Right. There's almost nothing, and it takes years to develop a new antibiotic, and then they're squandered.
Yeah. That I think that article that came out of the WHO really opened up a lot of people's eyes. Dr. Stone, sexually transmitted infections are rising in the U.S. and elsewhere. I report on it all the time. And you express some very specific concerns, particularly in the arena of public health funding and STIs. Can you discuss this further?
Sure. Well, already we saw that public health spending was 10% lower in 2013 than it was a few years ago. And as I'm sure you and your listeners know, Congress just voted to further slash public health funding. And the new legislation, while it may help certain people in the society, is going to decimate public health. It eliminates the Prevention and Public Health Fund of the CDC, which currently makes up 12% of the CDC's budget. And it's going to cut many things. So you're cutting the funding for public health. You're promoting ineffective, unscientific, abstinence-only sex ed that's been shown not to be effective. And what do you get? You get an increase in STDs and HIV. So one of the things that worries me about this, and I've written a lot previously, before the election, I wrote a lot about Mike Pence, because he actually scares me a great deal, and what he did in Indiana.
Can you explain that to the audience?
Sure. So in Indiana, they closed Planned Parenthood in 2013, though in this particular county, Scott County, it provided the only HIV testing and referral in the county. So what happened? They went from having 5 people infected with HIV each year to 20 new cases per week. That's per week, not per year, 20 new cases. So the CDC director then, Tom Frieden, said that the population there, which was only 4,200, had a higher incidence of HIV than any country in sub-Saharan Africa, and more than in New York City through IV drug use. So Pence did that, and he also diverted funds from HIV/AIDS prevention to gay conversion programs. The funding cuts in Indiana dropped to the point where they were spending $12 per person on public health compared to $220 for West Virginia. So given his beliefs, and that this kind of philosophy is growing in Congress, of cutting Medicaid, cutting public health, cutting Medicaid, cutting CHIP, all of these public health safety net programs are being cut, and so you can expect to see STDs and hepatitis and HIV skyrocket wherever that happens, just like it did in Indiana.
Now, one thing I did notice that wasn't mentioned in your STD section of the article was a lot of health departments, and I don't know if it's been proven or not, but a lot of health departments have come out and blamed apps like Grindr and Tinder, where people meet up and have this promiscuous. You lay no blame on that?
I do blame some on that, of course, but I'm not saying that there aren't social concerns too, but I'm saying that if you have a person with gonorrhea or syphilis, you track their partners and you get out in the field and you look for why this is happening. And if you don't have a health department to do that, and you don't have education, and you don't have sex ed that teaches people that, yes, you can get gonorrhea from oral sex, which they don't recognize is a risky sex act, it's all multifactorial, but part of it is education, and part of it is just regular education and public health, and that's, as I say, that's being drastically cut.
Yeah. Another thing that you talk about in the article is something that's very near and dear to me, is the vaccine preventable diseases, and you detail concerns with polio and measles specifically. But before I dive into that, just prior to you coming on, I had Dr. Peter Hotez on to talk about the anti-vaccine movement. And you're an infectious disease physician, and I want to ask you, how concerned are you with the growing anti-vaccine movement in the U.S. and elsewhere?
Oh, I'm appalled and terrified by it, because we had almost eliminated these infections globally. And certainly in the U.S., we had said we had eliminated measles, and we have eliminated polio in all but Afghanistan, Pakistan, and Nigeria, and now they're growing again, and it's so unnecessary that that's happening. And the other thing that bothers me about this, which I don't know if Dr. Hotez mentioned. But the other reason I think that we're seeing a resurgence of these infections that are almost eliminated, and why it's going to get worse, is that our societal expectations have changed. What I mean by that is, I'm sure you were raised, as was I, to look out for our neighbors and our communities.
Oh, sure.
And that we had certain norms of behavior. And that's called in the literature a social compact or social contract. And what we're seeing with these people who are refusing vaccines is that there are more and more people focusing only on their rights and sort of everybody else be damned. It's me first, it's me only. I don't care about my neighbors. I don't care about the community. And so the result of that is we're seeing people refuse vaccinations for themselves or their kids. They don't understand that these diseases are kill people, and they don't care, seemingly. They don't care that it's killing other people's kids who are immunocompromised in some way or are too young to be vaccinated, right. And they get measles then from these people who are so selfish. And I think some of it, again, is they don't have the education or the perspective or aren't old enough to have seen some of the things that Dr. Hotez and I have seen about people becoming ill or dying in the pre-vaccine era.
Mm-hmm. No, very good point. There is a lot of bad information out there, and if you go to these mommy blogs, seriously, this is what you see, and between that and celebrity and certain politicians, this is just horrible information to be putting out there. Now, to get back into your article, though, which I found this part incredibly interesting, was about the bad information and mistrust that affected polio vaccination programs in certain countries, particularly in the Muslim-type countries. What can you tell us about that? That's really quite tragic.
Right. Well, it started with a false vaccination program to try to find Osama bin Laden. and the CIA used vaccine workers as a ruse to track him. And when that was discovered, of course, there went any credibility for vaccination programs in Pakistan and Afghanistan. There are other similar areas, particularly in the Muslim community, where people, and this has been a problem in Nigeria and in the Somali community in Minneapolis, where again people think that the vaccines are a plot to sterilize them, or it's a CIA plot. There have been enough lies to the community in the name of public health, or using public health rather, that it's destroyed credibility, and that's why you have now healthcare workers who are giving vaccines being assassinated throughout those countries. And what can be more tragic than that?
I know. Yeah, and like I said, there is just so much bad information. Before you came on, I was reflecting back on an article that I did from 2014, and there was this anti-vaccine website that was putting out this absurd notion of a vaccine homosexuality link.
Right.
Yeah, it's
okay.
like
I missed that one.
Yeah, well, good for you. but the fact that this kind of stuff is out there, I mean, that's got Alex Jones written all over it, and that's just frightening stuff. Now, Dr. Stone, you talk about a topic that I don't think most other sites did in their year-end article, and that's septic shock.
I try to be different.
You were. I mean, I was pretty much here's the top 10, blah, blah, blah. But, yeah, yours was a very unique article. And you talk about the topic, and you actually say, like a lot of your article, you have some good news with this. Can you talk about that?
I know that's refreshing.
It is.
In this year. And there was this small report that caught my eye, and I wrote about it for two reasons. One is it's a rare bit of good news, and it's just been an awful year on many levels. But I was attuned to the report about a new treatment for septic shock, in part because throughout the 25 years that I was in my solo practice, I participated in a number of clinical trials for sepsis, along with developing new antibiotics. And none of the sepsis trials worked. Okay, we reduced our mortality, not because the drugs worked, but because of what we learned about better taking care of patients with fluid support and earlier recognition of sepsis and the like. And we got our mortality rate down to about 15%. From the expected 50% mortality. Right. But I was also attuned to this because just last month I had 2 patients die of septic shock. And I hadn't seen that for a long time. And boy, they just crashed and burned.
Quick, yep.
And so this good news caught my eye because of that. And in this very small study, and I emphasize it's a very preliminary study, this study showed that a hormone derivative called angiotensin II worked in this trial to support blood pressure better than standard care, which was not a placebo. It was better than standard care. And I also was attracted to this trial, or wanted to call attention to it, because it was unusually well-designed trial in that it was double-blind, meaning that the people providing the care did not know which drug each patient was getting, and the patients didn't know that. Right. And it was randomized. And most trials aren't designed that carefully now. So it was kind of the gold standard. So it's preliminary, but certainly was the best news that came along in some time.
Okay, well, that's good to hear. I'm glad something brought a smile to your face.
Hearing from you always does, too.
Oh, okay, thank you. Well, and lastly, we both mentioned in our articles of the end of year 2017 about the HHS Tick-Borne Disease Working Group, and they had their first meetings, mid-December, I believe it was. Mm-hmm. And hopefully something good comes out of this. There's a lot of people depending on this. What say you?
Oh, I hope it does. I am not so optimistic about this one for a couple of reasons. Mm-hmm. I would mention we desperately need better diagnostic tests for Lyme, and we need more surveillance because we really don't know where Lyme occurs. The first time I had Lyme, I didn't recognize it in part because we didn't have Lyme in Western Maryland, as far as I knew. Okay, so I was, seriously, I was slow to recognize my own Lyme disease because of the epidemiology. And since then, I learned, for example, when I worked north of Pittsburgh, and I just work part-time, but almost every time I worked there, I had patients who were hospitalized with Lyme. Their illness was so bad, with cardiac complications or various other complications. I don't see that where I'm working in eastern Pennsylvania. So we really don't know much about it. I learned that the Maryland State Health Department doesn't even do surveillance of ticks because they don't have the funding. And I'm sure that's true in other health departments, and it's only going to get worse. So we know that there are new tick-borne diseases emerging, like Powassan, like the Borrelia mayoni, and whatever else new is coming up with Borrelia. But we aren't going to know where they are because the surveillance is being cut and epidemiologists are being cut. So that's an issue, the lack of any decent diagnostic tests for Lyme. We don't know when we're seeing a patient whether they have Lyme or not. And we have on this committee, we have probably a mix of people, but we have two very adversarial groups with the Infectious Disease Society on the one hand, and patients on the other hand who are convinced that they have quote-unquote chronic Lyme because they don't feel well. And some not always reputable physician or testing service has said, oh, you have Lyme. So as a physician, I sit in the middle between them, okay? I know I have ill patients. I don't know what's wrong with them. I don't have any tests to diagnose what's wrong with them. Not just Lyme, but other tick-borne diseases are even worse. And they get angry when I refuse to give months and months and months of IV antibiotics. And I'm failing them. And it's an uncomfortable position. And as I say, these two groups are so adversarial. I'm not sure how they're going to work together on this. I certainly hope that they will, but have some concerns about it.
Yeah, I don't think you're alone. I would like to see more debate on this. I've had so many people from both sides of the spectrum on this show, and I straddle the middle just like you, and I would like to see some more solid studies and some more solid debate instead of name calling and you're crazy and you're this and that. But anyway, Dr. Stone, I'm running out of time here.
Okay. Well, thank you so much for having me back.
Yes, ma'am. Thank you, Dr. Judy Stone, for your time and expertise in another intriguing article.
Okay, thank you again. Happy New Year.
Same to you.
Bye-bye.
Okay, and that's about it for today. I want to thank my guest today, Dr. Peter Hotez, Dr. Judy Stone, and I want to thank you for listening. And I will see you next week on Outbreak News This Week. Good night, and God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.